Welcome to the office.
I knew I had scoliosis from I was 15, 14 years old.
Okay.
And it was already...
This is back in the Philippines?
Mm-hmm.
Okay.
Yeah, I was 14 or 15 that time, and in my swimming lesson, my teacher told me to have an X-ray. That's the first time I had an X-ray, and it was already like 45 degrees already.
When you were 14, 15 years old?
Yeah, the ortho doctor told me that I need to have a surgery.
To do what?
For my back.
But what surgery?
To put something in my spine.
Okay,
Yeah,
they wanted to put rods or pins or something?
like that for surgery, because he said 40 plus degrees needs to have surgery. So he said, no, we don't want to. Are there any other options?
Mm-hmm.
So he told us that I'm having braces, to wear braces for 24/7.
Okay.
So I was wearing it for 24/7. I stopped using it when I was 18 because it messed up all my... I felt bad. I mean, my confidence. I have low self-esteem and all that. And after that 19, my mom told me that we have to go to a different doctor, and then she told me to go to therapy. It's a therapy for the back where they put TENS in my back, TENS and hot compress. And
so for people who don't know what TENS is, it's microstimulation, right?
Yeah.
Microcurrent stimulation, low current. And the
They
idea is to activate
back.
the muscles in certain parts of the spine to hopefully try to balance.
Yeah.
And you did that for how long?
I think I only have 10 sessions at that time.
Okay.
I notice my body, every time I sneeze, I yawn, I cough, I can't do it. My back would hurt.
Your upper back?
I mean middle, I don't know, somewhere there. I can't do it. I was so desperate to see another doctor, and it's so timely that we have a chiropractor. They adjusted me for like 2 to 3 times a week.
Okay.
So I did it for like 4 months, something.
And you got relief?
Yeah. After that, 2020 January, my session ended, but I had this certain situation happen in work. I don't know when, but I noticed there's a left pain, like a shooting pain. I can't even stand straight. I was doing like this. Every inch of movement, it's so painful.
Left hip is what you're talking about, okay.
I went to an ortho doctor and he did an X-ray, so he didn't see anything in the bone. So he said, let's do an MRI. So he didn't see any inflammation or something, but when I hold it, I can feel that there's something. This is different from the other one. It's not the usual feel that I know. I know there's something wrong. Okay. But he said, no, there's nothing wrong, something like that. So
This is 2020 in Philippines or here?
January, Philippines.
Okay.
January 2020. And then he gave me meds.
Right, so you get here, you get to America, you're starting to work, you're a medical technologist. What does that mean? You're doing the same thing, drawing blood from people?
No, I don't draw blood
so
anymore
what do you
here.
Do now?
I'm just inside the lab. More on sitting, standing, like going
around.
On
a lab chair or a regular chair? Like a high chair?
It's like something like that.
Okay, but a little bit higher or is it about this height?
I like it higher. Okay. Yeah.
And so you're sitting and then you're in the lab, you're doing and you're moving around the lab. And how is your back holding up?
I'm super dependent in a body binder.
And you're talking about those belts that hold?
Yeah.
Is it a Velcro? Like a Velcro?
A Velcro type.
Okay. Is there a specific part of the body? Is it the pelvis, the low back, the neck?
When it gets painful?
Yes.
The lower back. And also here, and every time it gets painful, it immediately I always have a headache when that happens.
And that's where you are right now?
Yeah.
Okay, so what are you doing here? You're here for 1 day. What am I supposed to do in a day?
I know, there's a lot.
There's a lot of stuff going on.
Yeah.
And this is a good case to talk about in terms of educating people.
Yeah.
Because we're not fixing anything in a day, for sure.
Yeah.
I think you wanted some answers, okay, as to what's going on.
Yeah.
And we need to go over your x-rays in a little bit of detail, go over your foundation and explain what type of scoliosis is this. You've already had the measurements done. You had it done prior in the last set of x-rays. My thing is to look at the foundation, number one, and see are there anatomical variations in the vertebrae that this is the reality and you have to manage this? Or is there anything that can be fixed? That's what we need to look at. What we have to see here is this a structural scoliosis or functional scoliosis? A functional scoliosis is one that is created by alignment, and a functional scoliosis is created by nerve pressure, muscle imbalance, alignment issues. A structural scoliosis is something there's anatomical variations in the bone. That could be from birth, that could be from trauma, that can be from both. Okay? Now, first thing I look at in these cases, I take a line and I go from S1 and I run it up to the dens of C2. And the first thing I'm going to look at is, does that line up? And if it lines up, this is where the dens is. If it lines up perfectly, then there's nothing we're going to do to change any structure. So regardless of structure or function, okay? And the first news is it's a non-compensated. Has the body fully compensated or is it decompensated? So the body hasn't fully compensated yet to the scoliosis. So that's good news at least. Okay. The next thing we want to look at is, does the rib cage sit over the pelvis? And if we look here, what do we see? The rib cage sits over the pelvis, right? It's not shifted away. So in this scenario, that's the second part of it, is even though this hasn't fully compensated, the rib cage is over. And so theoretically, that's not going to change. If the rib cage was shifted away, offset from the pelvis, then there's a good chance we're going to get structural correction. Does that make sense? Yeah. Okay, so this looks more, the body has, the rib cage sits over the pelvis. I don't see that part changing, okay? I don't. And I'm always going to give the body and the person the benefit of the doubt though, and see what can we do, what can change. So let's go closer and see, okay? And let's see, do we have any anatomical variations in the body? We can see we have a short leg on the left, yes? This is lower on the left, this is higher. We're going to go through the numbers. I can see a little bit of a tailbone injury here, so I know, number one, there was some injury. This short leg started this process along with an injury. And we'll look closer at this in a second. And as we follow it up, what we want to see is, are the bones the right shape or have they changed? So when we look here, these are still square. This is concave, but it's still square, still square, still square, still square. But here's where they start to wedge. So these bones are already wedged. You see it's smaller here, larger here. They're already formed that way. And so with a wedge, I don't see that part is going to change, okay? I see that some foundation work can be done to give you some more stability. I do see that. And I'll go through the numbers in a second. But the fact that we have wedged bones here, these are wedged. And it's just those, because that's the apex. Okay? Same thing here. And as soon as we get to here, they start to normalize again. So these start to normalize in through here, even with the curve. The next question is, have the ribs changed? So these are your floating ribs, okay? These are the floating ribs. That's a floating rib. Then it's a little misleading because this should look thicker because it's back and posterior. That should look smaller. That's an X-ray projection. Okay? But the biggest thing here is these wedged vertebrae here are not going to allow the middle part of your back to straighten out. However, we can look at the foundation and say, can we change any structure? Can we balance the foundation so you don't need to wear that thing you wear? And I think that's the big thing. We've seen cases where we're able to help them, and what does that mean? And here's a good example, what I see here. Right now, you have a 14 millimeter measured difference. This needs to get under 7, man. You have a PIEX, so you have a drop pelvis on the left. And that, if we can get this drop pelvis fixed, it gets to 10. So it's going to go up 4. But we have a 7 millimeter deficiency of the sacrum. Now, if we took those together, there was a couple of good traumas, a couple of good falls, or a couple, whatever it was, very early on. And that was part of that process. Were those wedged vertebrae there at birth? I mean, I don't know. Okay? But the fact that we have this going on here and this is causing this short leg, and the short leg is not going to allow this to get better. So we got to get this part up. The good news is there is some correction that could happen in the pelvis. There is some correction that can happen in the sacrum. And in terms of putting a lift in, the issue with the lift is this. We can put one in here, not now, but I mean if you decide to do work, okay, which would help here. But it won't help the mid-back, and that's where those bones have changed shape. So it would help the low back here, but you'll have less low back pain, but you'd have more mid-back pain. So strengthening and specific exercises are going to be crucial and very important for you. Okay? And this is the reason I say this, Myra. Okay? Now we need to look at the side. And what I would say in the side profile is this. We had some tailbone injuries. Okay? 1, 2, 3, at least 3 to 4 good injuries when you were, I don't know what you did when you were playing when you were a kid, but you had some good, you had a couple of good falls. And that probably started the process. Now, regardless of what's going on with, there's the foundation work that needs to happen, and you have some neck issues that need to be worked out because you're getting this reverse curve and you're getting closure over here. So you still have good discs here. And I want to look at the flexion extension to see, look, in extension you have a normal curve. That's a normal neck curve. Yeah, but you have to look up to have a normal neck curve. In flexion, there's an answer right there. We have an answer right there. That didn't open. That one didn't open. That opened, that opened, that opened, that opened, that opened. But mira, check it out. We have an occiput, upper cervical issue. 2, 3, 4, 5, 6, 7. I see a C7 or even a T1. I see an upper cervical, and I see the foundation that we need to work on. You can see the curvature there. That's fine. You can see this side is higher, this side is lower. Go walk towards the corner, please. And what I want to see is, I want to see you moving through those dimples regardless. Come here. Sorry, I want to see these dimples move. Come on. Now we got a little movement in there. You can see the left foot is pronating. Close your eyes and walk straight.
I look crooked.
How does she do that?
Okay, Pisco.
Okay, stop. Walk towards me. Don't turn around though. We walk towards me.
Close my eyes.
Close your eyes, please. You can see she walks to the right side.
Yeah.
Okay, turn around. But now if she walks away from me, she was bumping into the left side. This is interesting because yes, her foundation goes to the right, and the short leg brings her back to the left.
Yeah.
Does that
When
sound
I'm
about right?
walking with someone, they always tell me that, why are you pushing me?
You're bumping them, right?
Yeah.
Come over here and have a seat. So we need to follow the contour. And the scope, this is good for students in Gonstead out there, the scope needs to follow. Okay, the scope needs to be in the center, equidistant to the spine. So people have asked questions, why does he tilt the scope? Why does he put more pressure one way or the other? It's because different patients have different looking spines, and so we have to follow the contour. And the first thing we're getting, we said we're going to find something up top. We have 15 points in the upper cervical left side. Okay, that's number one. There you go. Now as we follow the contour, you can see we get pressure in the mid-back. As we follow the contour, you can see we get pressure, but it didn't stop. Keeps going, keeps going, keeps going, keeps going, all the way down to S4, S5. That was her initial tailbone injury. So we have around T6, T7, S4, S5, and up top in the upper cervical. Static palpation following the contours. Tender there,
Yeah.
more tender there, more tender
Oh,
that one. Head down and let's count 7. 1, 2, 3, 4, 5, 6, 7, 8. Go back slowly towards me, please. Number 5. And it was brutal. Guess what I did? What do you think I did? I left the office. I couldn't do it.
Oh.
But then I figured out how to do it. I came back and I never left after that. You feel that?
Oh, yeah. Oh.
All right, number 5. 5 is tender.
A guy can.
1, a guy. What's a guy? Are you
Ouch.
cursing me?
No, it's
Okay.
ouch.
You're not cursing me, right?
No.
Okay. 3. I have patients from Philippines. I'm gonna ask them.
Okay.
Okay. A guy?
Yeah.
Which guy?
No.
Okay.
Ouch.
Right there. Not bad there, right?
Mm.
Starts there, S4 or
Okay.
S3. S3. Okay. Sorry, I had to.
Yeah, it's
sorry.
okay.
Top of the joint, we're doing motion palpation. Bottom of the joint are actually static. And it's tender here, yes?
Yes.
Okay. Let's go to the left side. Top of the joint, it's more fixated here. You feel that more there or there?
Okay. Yeah, that one.
So we have S3, we have left pelvis, we have T6, T7, let's confirm them. 1, 2, 3, 4, 5, 6, or 7.
That one.
7. Oh, this is going to be fun.
Oh. Mm.
So 7, 6, 5, 4, 3, 2, 1.
Oh.
More tender on the right. Right there.
Okay, cool.
Left occiput, S3 and T7. Hand here. And we're going to be on the supramastoid notch there. We're going to come down through it, okay? This way. Chin down a little bit. Good. PSLS. And away.
Okay.
And that's the home run. Gotcha.
Okay. Oh.
It's already going.
Yeah, I felt that.
That's Jedi. You got her? I'm not affecting here.
Okay.
And that's the home run. Gotcha. Thank you, Shashi. Who's this guy you keep calling? she keeps calling some guy. A guy. What about a girl? I'm just messing around. 1, 2, 3, 4. Oh, 7. 7, we're going to set. You see, I still got to go to the X-ray and look at the listing. 2, 3, 4, 5, 6, 7. That's a PR. That's a lot of rotation, PR. PR-T. Nope, PR. PR spinous. 1, 2, 3, 4, 5, 6, 7. PR. Gotcha. There's the rest. I got you and your guy. Shoo. Deep breathing. Hold my hand. Let's walk. Walk 2, 3 times. As you're walking, tell me if anything is different.
I don't know. But yeah, I like them, the cracks.
A little more movement in the back. Come here. Go ahead and walk, please. What's different in your walk?
It's not too.
Close your eyes. Shoo. Okay, come over here. Okay, we're going to be very, very gentle and light. Now, in her case, I'm not going to be tractioning up that shoulder, right? We don't want to disrupt anything there. I'm going to be down on the pelvis. So what I'm going to do is be on the posterior lateral aspect PSIS. You okay there? I got you. This is the easy part, by the way. The hard part's over. And we're just going to push it up.
Okay.
Relax the bottom leg. Bottom leg. That's it. That's it. Stay on your back, please. Okay?
Yeah. This was painful lately.
Raise your right leg. Relax the leg. Raise your left leg. Walk it off. So what I'm seeing from just the adjustment, you're walking a little bit different. Sit on the floor, please. Okay. However you sit on the floor. Do you sit on the floor?
Yeah.
Okay.
Yoga. During yoga.
Stand up. Should be a little easier to stand. A little bit easier, right?
Yeah.
Yeah. Come over here. Close your eyes and walk to the corner of the room.
Oh,
Cool.
I didn't bump.
You didn't bump. Cool. Have a seat. Neck is clear. That was a gangster occiput adjustment. Let's see the big test though, okay? That's clear. Let's see the big test. Come back slowly. Check it out.
Wow.
Check it out. 5. Better?
Yeah.
1, 2,
Oh my gosh.
3. What'd you think?
Yeah.
Ah, a guy!
No more.
No, you're done with that guy, right? You're done with that guy. Ears.
Oh, whoa. Uy.
So this case, guys, for the channel was more about education, and it was more about, I'm not fixing this case, right? I'm not going to say I am. What I am going to say is we're going to balance it and give her a quality of life, and everyone has an option. You can choose to have chiropractic care as part of your life, whatever that means, whether it's once a month, whether it's every 2 weeks, whether it's 3-4 times a year. Squeeze, are we clear about today's visit?
Yeah.
You got some answers you wanted?
I have something here in my right before. There's some, every time I do this when I was in grade school, there's something protruding over there.
It's called a ganglion cyst.
Oh, it's painful when I do yoga.
It's gonna hurt a little bit. Can I do it?
Eee.
Well, we can smack it with a book. Go on your knees on the table, on the floor, and put your hand on the table. Go on your knees.
Okay.
Ganglion cyst is coming from a posterior lunate. Okay, posterior lunate. Yeah.
Okay.
Relax the hand, relax the hand.
Ay.
Gotcha! Relax the hand, the speeder board is so I can get in there. There you go, one more. There. Move it around, take it up. Get a friend?
Yeah.
Do the yoga pose. Let's see what you got. What you got?
No.
Do it. What do you gotta do?
And
Put your weight on it.
this is still tighter
Mm-hmm.
than this one.
Stand up. That's lunate. It just needs work, okay? It's
Okay.
moving a lot better.
Yeah. For sure.
Come here.
Okay.
Bust. That's it.
Ah.
That's it. That's it. That's
Okay,
it.
okay,
Done.
okay.
Done. 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 There. Posterior ulna. There you go. Push. Yeah.
Oh,
Look. Do it again.
it's still inflamed now, so.
The movement is better.
Mm-hmm.
Okay? You just need to ice it.
Yeah. Mm-hmm.
All right?
Yeah.
Madam, welcome to the office.
Thank you, Doc.
You're welcome. You had one visit with me. You came a
Mhm.
few weeks ago, about a month
Yeah.
ago.
Yeah.
And it's for your scoliosis, right?
Mhm.
And we
Correct.
did a whole evaluation.
Mm-hmm.
We went over everything.
Yeah.
Tell us what happened.
There's a lot of changes for the past like almost 2 months. First, in my head, I can now tie my hair the whole shift without having migraine. I can't do that before.
Oh, wow.
Yeah.
Okay.
It's painful and I still have headache though sometimes.
Okay.
Because of motion sickness. That's the only part when I have long drives, I always have motion sickness and it's still there. But the good thing is my neck doesn't hurt anymore. Like my neck,
Okay.
I was shocked. I
With
really didn't expect.
one adjustment?
I didn't think with that adjustment because for having like almost 10 chiropractors, I didn't see any changes before. But
So then what did
I
you
didn't expect that.
Then what did you come for? What did you expect with coming up for one visit?
I didn't expect like a huge changes. So I was like, oh, I don't have that neck pain anymore.
Okay.
Like I noticed before, when I'm so focused in doing something, like I'm doing lab works, let's say, and
Yeah.
I always catch myself, my jaw is always like this, and my tongue is out, but my mouth is closed, so it's like that. I
Okay.
always do that. I catch myself doing that, and it's giving me tense. Not no pain, but it's lesser now.
Okay.
I don't know if that it has anything to do with the adjustment in my neck. So I noticed that, and then I don't tilt my head that much anymore, because I always catch myself doing that,
Okay.
tilting my head, because I think that's my comfortable position. I don't know.
Okay.
And then
How's the back?
the mid back, there's still pain in the mid back.
Sure.
And then, and what's I'm so shocked, my hips doesn't have no pain anymore. I don't have any pain anymore when I get up or lie down. It's so smooth. I can do I can do a lot of movements. Like,
Awesome.
seriously, yeah.
How about work?
At work,
Sitting, because you sit a lot at work, right?
sit and stand like and
You're in the
walk.
lab, right?
Yeah.
You're in the lab. So how's your lab work
My
then?
hips doesn't give me any pain anymore, but the mid back there's still pain, but it doesn't bother me because the hips is the one that I'm so concerned about before, and the mid back there's still pain if I do some lifting.
Okay.
Not a heavy lifting, but just lift like a water or something, like I have to carry it.
Okay.
Yeah.
So there's a lot of changes. With
Yeah,
one visit.
I'm so shocked.
Wow.
And
okay. That's cool. I'm a little shocked too.
Yeah,
Okay.
I didn't expect it, like seriously. So, I'm still using my binder though at work for the
Please.
past few weeks.
Yes.
And there's a time I forgot to use it, and I'm so anxious. I got so scared because I'm so used to wearing it for years.
You're talking about your brace, right?
Yeah, the binder, the
binder.
Velcro type.
Yes.
I get scared because my body is anticipating pain. It's what I already know in my body.
Her story of pain.
Yeah,
Mm-hmm.
so the whole time I was scared, and I feel like pain is coming, but yeah, I didn't feel any pain in my hips. I was like, oh my god.
This is cool.
I was almost so emotional that time. I don't. Oh my gosh.
This is good. It's okay. It was a big deal for you.
It's just so painful. I get to sneeze now without, like, it's smoother. But I still use my binder if I know that I have to carry something. Like my flight going here, I have to use the binder in the airport because I know I
Sure.
have to carry the luggage. Like it's not like carry it, but it's not heavy. But I think it will give me pain. I don't know. I'm still scared.
You still use it, okay? You
yeah.
still use your binder. You still use it.
Yeah, if I know that I have to carry something.
Right.
Because I'm scared. I don't want to be in pain.
Don't be
Because
scared.
if it's just a physical pain, I can handle it. But it affects my the way I handle things, like my relationship with other people. It's making me cranky. I don't like it.
Pain sucks.
Yeah. It's just not physical pain. It's not. Yeah.
The physical part is actually easy to deal with, isn't it?
Yeah.
It's when it starts
Because
affecting your psyche
I'm so
and
used to the pain, but
the story of the pain.
yeah.
Yeah.
Mm-hmm.
Okay.
And then my wrist, it's when I do yoga, it's not that painful anymore, but I can feel some pressure,
Sure.
but no pain. Yeah, that's what I notice the transition in the yoga, like standing up, going down, it's smoother now. My hips doesn't hurt that much. And when we do, like, there's a part in the yoga, like we have to lift our body or something, like while lying down. I can do it. Like I can do it like for 2 seconds. And I was like, why is it so easy for them? They can do it for like.
Everyone has different
Yeah, I was
mechanics,
like,
right?
I can't do it, so I have to wait for them to finish, and I was just lying there. Like, why can't they do it? I can't.
Well, hopefully soon you'll be able to do it, okay?
I can.
Oh,
I did.
Oh, you did? Okay.
Yeah, I was like, oh my god, I can carry my head.
Nice.
Yeah, I was so shocked. I didn't know I can do it. Like sit-ups, I can't do that before.
So I want to talk about something, and in her case, we talked about, we did the evaluation of your scoliosis, and what we found is we found some bones that have changed shape. So this isn't a case where we're going to do adjustments and we're going to straighten out your spine. What are we doing? We're trying to find your balance point. And with what we adjusted that first visit, we adjusted occiput, tailbone, and T7, I believe.
Yeah.
And that was enough to get the pressure off the nervous system and give you some quality, right? Give your body less tension,
Right.
and able to move better. And we'll evaluate you and see where you're at today as well, okay? And just know this is a management. It's finding a management point for her that gives her quality of life. That's really what this case is. Okay, so it's a little different, and I'm also pleasantly surprised.
Yeah.
I didn't expect that many changes in one adjustment. I expected a little bit though.
Yeah.
Okay, you ready to get started? Okay,
Yes.
so we're gonna check your spine,
Okay.
jaw, wrist, and feet, whatever we
Okay.
find. Okay. We started on our tailbone down here, and we'll see. We'll take a look and see. We'll probably do tailbone and push the pelvis up, depending on what we find. And in terms of the rest of the body, T7 occiput, I don't know until we examine, because just changing the foundation hopefully has changed a lot of the structure of the spine. You ready?
Yes.
Let's do it. We're going to continue on top. Occiput, left side. So what's interesting there today, now let's mark her spine, okay? So we can, one of the things when we're learning the work is we're taught to mark the spinuses. And by marking the spinuses, we want to bisect the spine with the scope, okay? Number one. Number two, we want to make sure it's equidistant. So we're not running it straight this way, that's wrong. We have to follow the contour. Okay, so let's follow the contour. And let's see. We got a tiny bit hiding out right there. That's around T5. Follow the contour, follow the contour. Didn't stop, keeps going to the sacrum left SI joint and then bottom right. Oh, you in for a treat today. Head down, static palpation. Right there. More tender at the bottom. This one, or this one?
Oh yeah, that one.
That one. So you see how many people responded to a guy? It's alright. It's R. They told me R.
Yeah, that is from the Manila people. Alright.
Alright.
Oh, okay.
1, 2, 3, 4, 5. The thrillers from Manila. Sacrum puffy, but still less. Let's check the hip movement. Back slowly first towards me. Let's check the sacrum. L5 is tender, yes?
Yes. Oh, okay,
S1,
okay. Yes.
S2, S3,
Yeah, that one.
S4. I'm outside, okay, on the bottom. S5. And down in the tailbone. Yes?
Not really, but
Not
it's
as-
tender. Oh, yeah, it is.
On the right.
Okay,
There
okay.
it is. There it is.
Yeah.
It's right coccyx, sacrum. Let's check the pelvis. Scoot forward, please. Feet together. Open and close the knees with the feet touching. Open and close. Right side only. Left side only. Pelvis is still not ready yet, so we want to do sacrum. S1, sacrum. And we want to do coccyx S5, T5, and let's check up top. Back slowly. Yes. Let's check the occiput. That's not moving. Right there. Left occiput, T5. And coccyx. All right, let's do this. Turn your head to the left. And we're going to do an occiput this way. Down.
Oh boy!
Gotcha.
Whoa!
Gotcha. Head down, please. T5. Hi! Good morning, LA! 1, 2, 3, 4, 5. You see how far out I have to be here, T5. Hand down, please. Gotcha. off, please. Hi.
And I walk smoothly. I notice it, like my hips doesn't give me pain anymore.
Nice. Let's go left side down, please, over here. Now, this is not a textbook move I'm doing, guys, because of the way the spine curves, but I'm down low S5 coccyx. It's going to be very light, very quick, not a lot of traction. Not a lot of traction in the shoulder for this one. You okay there?
Mm-hmm.
Yes?
Yeah.
Hey. I'm going to be on the outside here, okay?
Mm-hmm.
Right on the right. There. I'm going to bring it up. Let it roll.
Oh.
Gotcha.
Oh, that's it.
That's it. Let's go to the other side now. You still with me there, eh?
Yeah.
There it is.
Okay. Oh.
Gotcha. Stay on your back, please. Let's work on the foot.
There's a lot of clicking when I walk back a few weeks off. Oh.
Talus,
Okay.
fibula.
Oh.
Turn to your side, please. Bottom leg, top leg, calcaneus, navicular. Other side, please. Heel, navicular. Other, sit up and turn, please. More of a squishy set today. T5 is clear. Sacrum is clear. Would you look at me? Tell me what you see driving in my car. Are we there yet? All clear.
Wow.
Gangsta! Ears.
Oh, wow.
Open. Right EX, left AI. Let's check one other thing though. Hold on. Nope, that's fine. We're gonna do the right EX. Can I go?
Yeah.
Open all the way. Open. Close halfway. Hold. Hold. Don't move. Open. Good. Open. Open. Close half. Hold. Bus. 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 Open. Different.
Okay. No, there's no clicking.
Good stuff. Was it worth coming all the way from Missouri for one visit?
For sure.
Was it
Yeah.
worth coming all the way back for a follow-up from
Yeah,
Missouri?
for sure. Oh.
Shoulders. Walk it out. Check it out.
Oh, okay. But no, there's, it's different.
Let's check the hands. Squeeze. 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 Elbow.
Ooh.
Wrist. Squeeze. Relax there. Why are you going away? Come on. Relax the wrist. Elbow.
Mm.
Relax the wrist. Nice. Nice. Squeeze. Squeeze.
Is there any chance like the spine would, or like just maybe like the physical scapula would like less
Can it?
bulgy?
Can it? Yes. Will it straighten out completely? No.
Yeah. Mhm.
But can it get better by relaxing the nervous system and balancing the muscles more?
Yeah.
Yes.
Ah,
Should
okay.
you be looking at some sort of scoliosis workout program and stretches? Yes.
Mm,
Okay, there's a lot of channels and a lot of people out there doing that. that stuff.
Yeah.
And it's all pretty similar.
Mm.
Okay?
Yeah.
So you continue your movements, your exercise. I wouldn't be doing any weights, and hopefully I see you into the summer.
Yeah.
Okay?
Thank you,
God
Doc.
bless you. You take care. So it's been about 1.5 years,
Yeah.
right, since
Yeah,
our last
since
visit.
last year, yeah. So since my last visit, there's a lot of changes, like huge changes that I noticed after weeks or months after. I didn't notice it right away.
Okay.
You know, I didn't feel it yet. So I felt it like weeks when I noticed like so my life were like before you and after you. So I
Okay.
just say it like that because so before you I have this major complaint about my hips and it's not there anymore.
Okay.
My neck issue, like it's always painful,
Okay.
but I don't feel the neck issues anymore.
Okay.
The headache is still there. It's only like motion sicknesses, you know, but it's
Okay.
not like constantly there.
Every day? Not every day. Or is it every day?
During long drives,
Okay.
but it doesn't like last long compared to before. Like I have migraine every single minute, you know, but
Okay.
I don't feel it anymore. Since my last visit last June, I have
She's talking June of 2023.
yeah
We are
last
we are-
2023.
And we are December 2024
Mhm.
right now. Okay.
I noticed since then I have my monthly period, and
Okay.
it never ever happened. So I don't
Interesting.
know if it has anything to do with what you did. So
Well, I can't say anything like that, but the fact that your cycles they're normalized now, and prior to seeing us, you had your cycles or you didn't,
every 3 months, every other month.
and now it's regular.
Yeah,
That's pretty cool.
yeah,
Alright.
it's amazing. I don't know. I don't know if it's anything.
Well,
to
we
do.
can't
It's
say
like,
anything
yeah,
like that, but okay.
Yeah.
Very cool. This
And
is really good.
Yeah, and I noticed so before you I couldn't really do like coughing, sneezing, yawning, like do it properly because my back would hurt, you know. So now I can do it, and then
So what she's talking about is almost like a Valsalva maneuver. It's an orthopedic test where cough, sneeze, or bear down causes pain, usually a disc
in the
problem,
mid-back.
and you don't have that anymore.
No.
Okay, that's good.
And also I noticed I could lounge in the floor, in the bed.
Okay.
Yeah, I couldn't do it before. Like maybe if I do it before, like maybe a minute, it's painful already. Like if I don't have anything to lean on, it's painful. But I notice now that I could do it.
You have
Like,
more stability.
mhm,
What about
right.
work? You're a lab tech, right?
At work, I don't wear my binder anymore
Okay.
since
When you say binder, what do you mean?
the Velcro type.
The Velcro
So remember,
binder, just for them to,
Yeah, because I was using that before, like every single day.
like a Velcro brace?
Every time, yeah.
Okay.
I use it at work like for 8 hours the whole
Okay.
shift before for years, and then when after you I was still using it like maybe once a week. I know like 3 times a week, and then you know until it lasts, until I don't use it.
Okay.
Like I don't have the feel to use it. I don't need it, you know.
That's awesome.
Yeah.
Now, what about today? What's going on today?
So
Because we're going to tune up. We're going to check everything.
last summer, so I was doing great, and then last summer, this year, I went cliff diving. So I was like, God, I mess up your work.
Did you have fun? Did you enjoy it?
Yeah, I had
Yeah?
fun, but
You're feeling your back?
Yeah, I felt in my right. So if this is the spine,
Yes.
my right side.
The take-home message here is with scoliosis, yours became a management issue, finding your new balance
Yeah.
point. And by doing that, you have better function. And you decided to go cliff diving.
Yeah.
Okay, so
Like-
it is what it is. Okay.
Yeah, because I've been trying to do a lot of stuff. I can go biking now. Like last year, I did biking because
Okay.
I can't do that before because of my hips. You know,
Okay.
I did biking, I did swimming and jogging, walking. It's like, oh my God, I got my life now. And then, yeah, and
That's cool.
and then August
That's very
happened.
cool. And the first thing we're getting is the base, C6, C7. C1, 5 points, left side. C7, 10 points, right side.
Oh.
Oh my, we're gonna get it today. Now what you'll see is we're following the contours of the spine, and regardless of the curvature, we're looking for nerve pressure, guys. We're looking for pressure from the imbalance. L3, T5, C7, C1. Let's check down in the low. And there it is. S4, S5, 5 points. So we have 1, 2, 3, 4, 5. Static palpation, you can see the swelling inflammation pool right there. And it gets a little orange peely right there. 1, 2, 3, 4, 5. Tender there. 5 or 6.
Oh, there.
7, no, 6.
That one, 6.
L5, L4,
Not.
L3, L2.
Oh, that one.
2.
Oh.
S1,
Okay.
S2,
Okay.
S3.
Oh, that's more painful.
S4, S5. 4 or 3.
Oh, the 3.
3.
Oh, that's
Start
also
it.
painful. Oh.
4.
Yeah, that's painful.
S4, 5, 4, 3. L2, this one or this one?
Oh, that one.
That's actually
Oh,
L3.
guys. Oh, yeah.
L3, S3, T6, 7, 6. That one's not moving. We're going to wait on the neck, okay, on the top. We're going to do the base.
Okay.
C7, T6, L3, and S3. Sorry, S4.
Okay.
We'll start there, okay? Now, before we do, I'm going to have you walk. Okay, walk to the corner of the room and back a couple of times, please. So as she's walking, one thing I need to work on also is that left ankle. We'll tune up both, but there's more of a drop pronation on the left ankle as a compensation. Okay, have a seat. Showtime. All right, so we have the left hip on the X-ray. We have the S5. All right, here's how we're gonna do it. We're gonna do S4 first. Then I'm gonna have you walk. Then you're gonna come back, and we're gonna do the pelvis. Then I'll have you walk, and we'll go do the other stuff.
Okay.
The last thing I'm gonna do is your L3. Okay. And we have the high side of the curve up on her here, right there. I'm gonna hold you here, okay? You good? Good. That's a baby one. It's tight today.
Yeah, so stiff.
Yeah. Let's push it up a little bit more. More. That's a piece. Come up.
Oh.
And let's go face down.
Oh.
Oh, that's ready
Yeah,
to
I
go.
felt that.
S4. Nice and easy there. We want to torque up to bring that left side up.
Oh.
Gotcha. Nice. You can see I'm going out this way because 6 is all the way out here. Nice and easy there. Gotcha.
Whoa.
You okay there?
Yeah, it's not painful. A lot are messaging me if it's painful or not. It's
not like the first one, right?
I mean, it's not
Slide up a
painful.
little bit. People have been asking
It
you.
feels good, yeah.
I'm on your left bum. I'm holding the right, pushing the left up.
Oh.
A little bit more. Pushing the left up. There you go. Hold my hand, please. And let's walk. Different?
Yeah. Smooth.
Let's go left side down, please. Just a little more involved side down. Let it roll. Let it roll.
Oh.
That's it.
Ooh.
Gotcha. C7. Bring it up, down, up.
Oh, wow.
Gotcha.
Ooh.
That's the home.
It feels nice.
Six is clear, 3 is still there. Sacrum is clear. 7 is clear. Still a tiny little bit up top, just a tiny one. Okay, let's do L3 because that's an important one. L3 to the knee, the testy, and the ovary. 5, 4, 3. L3, knees back, please.
Okay.
Left knee back a little more. There you go. Nice and easy there. Good. Gotcha. That's the whole one. That's it. That's it. I'm holding. Good. Very squishy today. Come up slowly, please. Hold my hand. You'll thank me in a minute. Okay, walk it out. Walk it out. Walk it out. And then have a seat over there. We'll do C1. Nice and easy there. Good. Drop it down. Good. Drop it down.
Oh, wow. Woo. Oh gosh, that's nice. Feels good.
Walk it off one last time.
Woo.
Not as spicy as our first visit,
Oh
is
yeah, especially the very first adjustment in the neck. That was really spicy.
Mm-hmm.
Okay.
And that's the
Oh.
home run. Gotcha. Let's go on your back, please. Let's work on your feet and your knees. AIN femur here. Posterior tip. AS talus, medial tilt. Posterior tip. I'm going to do a little bit more of that face down. Now the fun part, Mara.
Oh.
I'm going to use a little lotion for that tibia, okay?
Good, okay.
Now the fun part now.
Oh, guy.
A guy is right. A guy, a girl, but now what we're doing is we're working the capsule. Alright, so traction, open up the joint, start to feed it in. Myra, if it's too much, you tell me, I'll stop, okay? But I gotta work this thing in.
Okay, 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 okay.
5, 4, 3, 2. Hold on to the top of the table, please. Hold both hands. Hold.
Okay.
There you go. Hold, hold. I got you. Hold, hold. Perfect. That's the home run, lady. Come on up, walk it off one more time. And then we work on the jaw. Good times.
And also my wrist.
I'll work on the wrist, don't worry. We'll tune up the elbows and wrists. Okay. You ready?
Yeah.
Center on the chair for me, please. There you go. Alright. Let's use the condyle block. This is a condyle block used to stabilize the cervical spine so it doesn't disrupt anything when we're working on the jaw. Look up. Slowly open, open. Left goes first, right compensates. Okay, so we're going to do the compensation side first.
That's painful.
Open all the way. Close halfway. Close and hold. I'm going right to left. 5, 4.
Whew.
Woo!
Oh. painful, but it feels it feels good.
Can I do the left side?
Yeah, sure.
Open all the way. Open, open, open. Close half. Let's do that right. That's it.
Okay.
That's it.
Woo.
We only have about 3-4 people outside waiting. It's all right. It's all good. Open all the way. Open, open. Slowly close. Ya guy.
Okay.
I gotcha.
Oh.
I got the guy. There you go. Nose is good. Open. Open. Open all the way. Close. Close. That's it.
Oh, good.
That's all. Whew. Whew.
Yeah.
Good?
Yeah, it's different. Still inflamed, but I think
Look at
it's
your
good.
shoulders now, okay?
Okay.
AIN shoulder.
Ooh.
AIN shoulder. There you go. So the take-home message with Myra is she has that structural scoliosis we're balancing and managing, right? And we saw you about 1.5 years ago. And let's see how you do with this. You have any questions for me?
I don't know. I can't think of any.
What time is your flight back?
6 p.m.
Okay. Stand up for me, please, over here. Squeeze the hand. Squeeze hard. Squeeze. So, are you going to be in the neighborhood? You're going to be around here?
Oh, yeah. Yeah.
Okay, why don't you do this? You want to come back later in the afternoon? Just to tell us how you did. If you're in the neighborhood. Squeeze. Squeeze.
All good.
Questions?
Thank you. I don't know.
I'll see you in 1.5 years.
Okay. Yeah, next year. Maybe.
Next year, God willing, okay?
Yeah.
Happy New Year, happy
Thank you.
holidays.
Happy holidays.
It was a pleasure.
Thank you so much.
You're welcome.